Sha'Asia Washington was ecstatic to become a mother. Posing in baby pink for her soon-to-be-born baby girl, her maternity photos showcased the 26-year-old's wide smile as she awaited the days leading up to the birth of her first child. She went into a hospital in Brooklyn, New York with abnormally high blood pressure, which was even more concerning as she was several days past her due date. After being pressured into getting an epidural, Sha'Asia's baby's heart rate dropped, forcing the doctors to perform an emergency C-section in order to surgically deliver the baby. Sha'Asia went into cardiac arrest in the middle of the procedure and died shortly after her daughter Chloe was born. Sha'Asia's death could have been prevented, but because she was African American, the healthcare system has been designed to neglect and dismiss her needs solely based off of the color of her skin, despite how dire her situation was. Sha'Asia is just one of the many Black and African American women that die in childbirth at the hands of careless and neglectful hospital staff. Black women disproportionately face maternal mortality, and according to Blankner.com, they are 3 to 4 times more likely to die from pregnancy-related causes. Therefore, I am calling for the dismantling and reformation of the racism and discrimination prevalent in the healthcare system, and in order to prevent more wrongful deaths of Black mothers who are the root of all life on this earth. According to the National Partnership for Women and Families, Black women experience more maternal health complications than white women do. They are more likely to exhibit symptoms for preeclampsia, one of the leading causes of maternal death, and yet their concerns will still be ignored or dismissed. I will be discussing the deeply rooted racism in the healthcare system that is killing Black women shortly in or after childbirth, the origins of the racism in the healthcare system, and discuss some solutions and action that can be taken to prevent further maternal mortality. Black people face the wrath of structural racism everywhere they go, and for Black women specifically in the maternity ward. Discrimination is a death sentence caused by the blatant neglect that Black women receive in the maternity ward from healthcare professionals. From 2006 to 2017, non-Hispanic Black women experienced a pregnancy-related mortality ratio of 40.8, which is higher than any other racial or ethnic background, as reported by the Center of Disease Control. And this was in direct comparison to white women, the pregnancy mortality ratio of white women, which was only 12.7. The cause of this disturbing statistic is tragic but simple. The healthcare system does not care about Black women. Basically, Black women are undervalued. They are not monitored as carefully as white women are, and when they do present with symptoms, they are often dismissed. Dr. Anna Langer, director of the Women and Health Initiative at Harvard T.H. Chan School of Public Health, revealed in an article by the American Heart Association. The deeply implanted roots of the discriminatory patterns in maternal and infant health stem from the compromising of the enslaved Black women's childbirth experience in order to serve only the interests of white slave owners. Since the founding of this country, Black people have been disrespected and disregarded in America. Black pregnant women were not only enslaved, but also wrongfully experimented on. Due to the lack of knowledge and research in the early days of obstetrics and gynecology, white physicians and surgeons used the bodies of Black women to experiment on and further their studies. Explained in the article Black Maternal and Infant Health, Historical Legacies of Slavery, the impact of racialized science on the field of medicine today is painfully illustrated by the deep linkages that American gynecology has with slavery. Many of the field's most pioneering surgical techniques were developed on the sick bodies of enslaved women who were experimented on until they were either cured or died. The racist nature of the practice of obstetrics and gynecology is still quite evident today, but instead of being experimented on, Black women are now being ignored in the maternity ward altogether. Now that the field is much more advanced in knowledge and technique, Black women are no longer needed for experimentation, but white society used them to develop life-saving surgical techniques and treatment, but somehow now they're unworthy of receiving it. How are Black women supposed to trust a field that has failed them from the start? The most obvious solution is to knock down the racial barrier that is blocking Black women from receiving quality care and support in childbirth and in the recovery process. It is imperative that hospitals provide care that is responsive to the needs of Black women, and not only should their treatment be on par with white women's, but it should be even more intensive and caring, due to the fact that Black women often experience more severe complications in pregnancy and exhibit symptoms earlier than white women do. Racial bias should be dismantled in the hospitals, and healthcare professionals should undergo training to address racism, learn to control implicit bias, and provide better resources for low-income women of color. More physicians and nurses of color should also be implemented in the system as well, to reflect the diverse population of patients that it serves. Today I informed you of the issue of the disproportionate amount of Black women that are dying in childbirth, the racist ideals that the healthcare system was built upon that directly contribute to this issue, and I provided a few solutions that can be taken to reform and dismantle the discriminatory ways of the American healthcare system. What many people fail to realize is Black women are the root of all life. The first people on this earth originated in Africa, so we are all descendants of the first mother, a Black woman who was responsible for carrying on the seed that would bloom into the entire human race. She held the weight of the world on her shoulders and the children of the earth in her belly. She held the weight of the world on her shoulders and the children of the earth in her belly, and she is the ascendancy of us all. And we see her reflected in Black women throughout the ages. Her direct descendants carry on her legacy in their own brown, outstretched bellies. So how dare the white man reduce the Black woman's struggles down to nothing but the ashes she inevitably becomes when her pain and struggles are ignored? How dare the system be designed to keep Black women from carrying on not only their own bloodline, but the very blood that pumps life into the veins of humanity? My mother, yet another carrier of the lineage of the world, was similarly disrespected just as her sisters who came before her. Shortly after giving birth to me, she was neglected for nearly 12 hours and was found bleeding out as a result of doctor error that occurred in the C-section that brought me into this world. My father was left begging and pleading with doctors just to find one who would be willing to save her life. Although she survived, her days are burdened with many complications and a permanently declined state of health as a direct result of the doctor's blatant carelessness. Her brown skin is beautiful, and as a direct descendant of African kings and queens, she and the Black women of the world deserve to be treated as such. They are the ones carrying on the lifeline of the world. Her heart serves as the center of the universe, and her heartbeat sings the song that provides life inside of all of us. Thank you.